So, good morning, students. So far we discussing about the histopathology. So, in your unit 5, it is all about tissue processing and embedding. So, if you see your unit 5 syllabus, if you see your overall syllabus, so totally we have 5 units and one extra unit also there, which is unit 6. So, unit 6 is all about automation in histopathology. So, unit 6 I will discuss in the next lecture. So in today's lecture, let us do a quick revision of the syllabus overview. So in the unit 1, we have introduction to pathology. So here we studied about the basics of pathology, like what is pathology, what are the branches in pathology. Then we discussed about what is the cell injury, how the cells will die. We discussed about types of cellular death, like we discussed apoptosis, necrosis. Then we discussed about basic mechanism of inflammation. So how inflammation occurs and what is the classification of inflammation. Then we discussed about what is the complete pathophysiology of inflammation, like we have, right, the signs of inflammation, then vascular changes, and the role of white blood cells in inflammation. So all these things we studied in introduction to pathology. Then in the second unit we have clinical pathology. So clinical pathology is a sub branch of pathology where we will study the body fluids. So body fluids such as urine, blood, synovial fluids, pleural fluids, pericardial fluids, even stool, semen, even sputum is also studied in clinical pathology. So here we will study the body fluids. So particularly in the unit 2, we have introduction to fluids. Then we have this urine fluid examination. So urine includes a physical, chemical, and microscopic examination of urine. Then we have semen examination. Then we have occult blood detection. So occult blood in case of stool. And we even have physical examination of sputum. We have physical examination of sputum. So these are the things that we studied. And in the unit 3, we discussed about different types of body fluid abnormalities. So there we discussed about how fluids are formed, and we even given a basic classification of body fluids. Like we have extracellular fluids and intracellular fluids. So intracellular fluids are the fluids which are present inside the cell, whereas extracellular fluids present outside the cell. And further, these extracellular fluids are further divided into 3 types: transcellular fluid, transitional fluids, and the serous fluids. So serous fluids are the fluids that are entrapped within the 2 membranes, and these serous fluids uh, plays a crucial role. So these serous fluids include a CSF, pleural, pericardial, synovial, peritoneal, ascitic, gastric fluids, or even your intraocular fluids are the serous fluids. So all these serous fluids, sometimes what happens due to some vascular permeability or due to some secondary infections, they will be at a increased capillary permeability, or due to some other reasons, the fluids will abnormally retain in the tissues. So there will be an excessive fluid accumulation within the tissues, leading to edema and formation of localized inflammation or fluid accumulation within the tissues, resulting in abnormal function of the corresponding organ. So such conditions, conditions are called as edema. So this edema are basically characterized into 2 types. Either it can be the transudates or exudates. So transudates means where there is only fluid accumulation. In the fluid, if you see any pus cells, means such kind of fluids are called as exudates. So that is the main idea here. So first, whenever we have any fluid accumulation, first we need to know whether the fluid is either a transudate or an exudate. After knowing whether it is a transudate or exudate, we will go for further investigation such as a differential count, microscopic examination, biochemical examination, or even we will proceed for culturing the sample to see any growth of any bacteria or fungi. So all these things we will see in the body fluid abnormalities. So here we discussed about synovial fluid. So the procedure of obtaining synovial fluid is called as arthrosynthesis. Then the procedure of obtaining bronchial fluid, which is our pleural fluid, is called as a thoracosynthesis. Then we discussed about the examination of peritoneal fluid and ascitic fluid, and the procedure is called parasynthesis. And we even discussed about certain criteria to differentiate the pleural fluids, either it is a exudate or transudate, and we even discussed about the causes of exudate formation and causes of transudate formation. So all these things we discussed in the unit 3 actually. Then in the unit 4 we have histopathology. So this is one of the major branch in pathology where we will study the tissue organs of the body. We will take a piece of organ from the body and we will go for a minor tissue processing steps, and ultimately we will study that section under the microscope. We will see the microanatomy of the tissue. So if there is any changes in the cells, means that indicates a pathological condition within the patient. So changes of the cells such as hypertrophy, atrophy, metaplasia, dysplasia, or even this cellular transformation will be detected in these slides. By seeing that, we can able to uh, determine whether the cancer or any condition, whether it is a benign or malignant. If it is benign, we will go for surgery. If it is malignant, we will go for chemotherapy to the patient. So all these cancers usually detected by using this histopathology techniques. So in the histopathology, we have different steps actually. So first we need to collect the specimen. Either it can be from autopsy or biopsy. Then we will go for reception. Then we will go for fixation, dehydration, clearing, infiltration, embedding, block making, section cutting, staining, mounting. So we have few steps in doing this histopathology technique. So histopathology was covered in unit 4 and unit 5. Then in the unit 6, we have all about automations. So what are the automatic machines that we are using in the pathology lab? So like we have automatic tissue processors, cryo frozen section cutting. We have um, automatic stainers, slide stainers. We even have different types of automations within the um, histopathology lab. So we have one particular domain called histochemistry, so or immunohistochemistry. There we will use antibodies to detect certain antigens within the tissues. So all those automation studied will be studied in the unit 6. Okay. So let us do a quick revision of last lecture. So as we know, these are the steps in tissue processing. The steps include specimen collections, specimen reception, gross examination, fixation, dehydration, clearing, infiltration and impregnation, embedding and block making, section cutting, staining and mounting are the steps in tissue processing. Then we discussed about what is gross examination. So gross examination means upon receiving the specimen from the surgical ward, it can be either biopsy specimen or it can be either even autopsy specimen in case of forensic department. So after receiving the specimen, the first and foremost thing that we need to do is we need to physically examine the specimen for some gross features such as the weight of the specimen, color of the specimen, dimensions of the specimen, surgical margins of the specimen, the color, shape, weight, surgical margins, associated structures, and also even cut surface description will be given on the gross examination. Then we will take a micro photograph. We will take one photograph of this particular section, this particular biopsy specimen, and we will proceed for further investigations. Then we will do the fixation. So fixation is a process of preventing tissue from decomposing. So this fixation can be done by suspending the tissue in a fixative solution. So these fixative solutions such as we have formalin, we have 10% formalin. So we have many fixative solutions, and these fixative solutions will prevent the tissue from decomposing by forming crosslinks. So protein crosslinks will form within the tissue. So due to this formation of crosslinks, the tissue cannot decompose. So the proteins will be linked, fixed. So there won't be any decomposition of the tissue. So this is the idea of fixation. So we have different types of fixators like simple fixators, compound fixators, and compound fixators. We have further different types like we have microanatomical fixators, cytological fixators, and histochemical fixators. And cytological fixators are further divided into two types. Like we have the nuclear fixators and cytoplasmic fixators. In case of nuclear fixators, we have Carnoy's fluid. In case of cytoplasmic fixator, we have Champis fluid. So all these things are studied in the fixation. Then we have dehydration. So dehydration is a step where we will remove the water from the tissue, and this water will be replaced by the alcohol. So this tissue need to be subjected in a sequential manner, right? So in a graded alcohol, we need to subject rather than directly suspending the tissue in a 100% absolute alcohol. We will suspend the tissue in a graded alcoholic solution starting from 70, 80, 90, 95, 100. So by that, we are trying to slowly remove the water from the tissue rather than sudden removal of water. If we are suddenly removing, it may cause damage to the tissue. So routinely used dehydrating agents within the lab are ethyl alcohol, methyl alcohol, isopropyl alcohol, or also or acetone can also be used as a dehydrating agents in the laboratories. Then we discussed about the clearing solution. So clearing agents are the agents that will uh, they will they will replace the alcohol within the tissue, and also these clearing agents will enhance the infiltration of paraffin wax in the next step of tissue processing. So clearing agent, the main criteria that we need to ensure whenever we are using the clearing agent is the refractive index of the clearing agent. Usually the refractive index of the glass slide is 1.51. So similar refractive index containing clearing agent must be used for clearing purposes. So whenever we are using any clearing agent, the refractive index of the clearing agent should be around 1.51. So that is an appropriate clearing agent refractive index. So here we can use different types of clearing agents. So regularly used clearing agent is xylene. So other than xylene, we can also use toluene, benzene, chloroform, or even natural resins such as cedar wood oil, mustard oil, or even coconut oil can also be used as a clearing agents, right? So you need to be very cautious when you're handling these clearing agents, because all clearing agents are either poisonous or carcinogens. They may induce cancers in our body, or upon inhalation they may become poisonous to us. So we need to be very cautious when we are handling these particular reagents in the histopathology lab. Then infiltration and impregnation. So infiltration and impregnation means it is a process by which we will suspend the tissue in a hot wax. So the wax will start infiltrating into the pores of the tissue, so the tissue will become hard. For this purpose, we will use wax at the temperature of around 62 degrees centigrade. So at this temperature, we will suspend the tissue, so the wax will start impregnating within the tissue. So we have different types of impregnating agents, such as we can use microcrystalline wax, sericin, rubber, beeswax, or even dental wax can be used as a infiltrating agents. Then after infiltration, we need to go for impregnation. So, infiltration and impregnation are both are same. Okay. So the procedure of then the next step is block making, embedding and block making. So whenever we are preparing this block making, there are certain things that we need to remember. So usually we will use this paraffin wax, and there are certain properties that the paraffin wax need to be satisfied. So the properties include the paraffin wax need to be easily prepared in large volume. It should have minimum supervision. It should be cheaper than other impregnating agents, and this paraffin wax should not interfere with the staining. We should able to easily remove this paraffin wax from the tissue. Then some more points to be remembered are we need to ensure that there is no dust or grit present in the paraffin wax. It should not contain water, because the presence of water may make the wax into crystallization. And we should able to filter the wax if whenever possible. And the wax should not have very higher melting temperature or very lower melting temperatures. In case of both higher and lower melting temperatures, we will form ribbons of the section, so that need to be prevented. So these are the points that we need to remember when we are using the paraffin wax. So that's it. So embedding and block making, what we will do, we will take that section, we will take blocks, and in the block we will add the liquid wax, and in this liquid wax we will suspend the tissue, and after waiting for 2 to 3 hours, the wax will become solidified, and it will prepare a block, which is where the tissue will be embedded within the block. So this is called embedding and block making. For this purpose, we can use different types of embedding agents. So the regularly used embedding agents include paraffin wax, water-soluble wax, ester wax, polyester wax, microcrystalline wax, epoxy, urea formaldehyde, agar, gelatin, or even celluloid can be used as a embedding agents. Then the procedure of block making. So the blocks will be prepared by using a special molds called Luca-Tel molds. So we will place this Luca-Tel pieces, and we will pour the liquid wax, and we will suspend the tissue, and we will obtain the blocks out of the tissue. So the special gases that we used for embedding and block making are Luca-Tel molds. So Luca-Tel molds will be used for embedding and block making purposes. Then we discussed, so this is the procedure of block making. First, we will take the liquid wax within a cassette, and then we will suspend the tissue within the liquid wax. Then we will proceed for solidifying the wax so that we will get a block out of the tissue, and this block can be used. This block can be introduced into the microtome machine, and the microtome machine will start taking the sections out of this thing. So this is a tissue which is embedded within the waxy block. So casting, so there are a few steps of casting. This we already studied. Then we have the next concept is automatic tissue process. So usually in the histopathology we will use different types of automatic tissue process. Broadly, these two tissue processes are classified into two types: open hydraulic tissue process and closed vacuum tissue processes. So open hydraulic tissue processes are the processes that will have hydraulic system where the centerpiece will elevate up and it will change the specimens from one jar to another jar. So totally it will have 12 stations or 12 jars, and at a regular interval of time, they will suspend the tissue in different jars containing different solutions such as xylene, alcohol, liquid wax, etc. Right? So this is all about the open and closed automatic tissue processes we have. Then in the unit 5, we have tissue processing. So in the next step will be section cutting. So section cutting can be done by using a specialized machine called microtome. So this microtome will prepare the sections. So the thin sections can be obtained by using this particular microtome machine. So let us know the basic parts of microtome. So the basic parts of microtome are: it has a handle rotator, safety pin, the thickness of the section adjuster, then knife holder, knife clamp, discarding wax discarding or waste discarding tray, sample or block holder, and it will even have chorus feeder on the left side of the microtome machine. So these are the basic parts of the microtome machine. So, and we have different types of microtomes also. We have sliding microtome, rotatory microtome, rocking microtome, freezing microtome, base ledge microtome. So rotatory microtome is the commonly used, routinely used microtome within the labs, and sliding microtome will use for cutting celluloid in embedded tissues, and rocking microtome is used for it is one of the ancient microtome which is developed by Cambridge University for cutting small pieces of sections. So small pieces of section can be easily cut by using rocking microtome. Then we have freezing microtome. So freezing microtome is an advanced microtome where we can able to freeze the section and we can able to obtain thin slices of the sections after freezing them. So this the advantage of freezing microtome is we can bypass the steps of tissue processing and directly we can go for section cutting. So the 2 days procedure of section tissue processing can be done within 2 hours. So that is the main advantage of freezing microtome. Especially this is used during emergency situations such as when the patient is in the surgery ward and immediately the doctor need a report to see what type of tumor the patient has upon doing surgery. So in that emergency situations, we will proceed for freezing microtome. Then even we have one more microtome which is called base ledge microtome. So base ledge microtome advantage is we can able to obtain larger sections of the tissues. So it is extensively used for the purposes of obtaining sections of a neural system of our body, such as sections of the spinal cord, brain can be obtained by using this particular base ledge microtome. Then we have different types of microtome knives. So knife will have certain if you see the anatomy of the knife, it has some parts like it has a heel, toe, honing guide, handle. Like this, we have some parts, and we even have some knives. So the knives that we used for section cutting are planar concave knives, wedge profile knives, or chisel knives can be used for section cutting. So then regularly these knives need to be sharpened. So if we are not sharp, upon regular use, these knives will become blunt and we need to sharpen those knives periodically. So sharpening of, when we are sharpening the knife, we need to consider a few angles. So there are few angles such as rake angle, clearance angle. So clearance angle clearance angle is around 2 to 4 degrees, which helps to prevent friction between the knife and the block. Clearance angle is formed by the line drawn from the block surface to the lower bevel of the knife. Then the other angle is rake angle. So rake angle is the angle between the upper bevel of the knife and the lower drawn at 90 degrees to the block surface. So greater the rake angle, better the sections for soft section, for soft tissues. The rake angle is reduced while cutting hard tissues. So rake angle is adjusted for cutting hard and soft tissues, whereas the clearance angle is used to remove the friction between the knife and the tissue. So this is the main the importance of rake angle and clearance angle. So whenever we are sharpening the knife, we need to ensure that we are maintaining this clearance angle and rake angle of the microtome knives. So coming to the sharpening of knife. So sharpening is called as a honing. This honing can be done. So honing means grinding of knife on a horn to restore the strike cutting edge of the knife is called as honing. This honing can be done by using different types of materials such as we can use Belgian black vein, or we can use arachnas, or we can use glass plate, or we can also use carborundum or alaxar can be used as a honing agents. Then, whenever we are honing the knife, we need to add some lubricants. Lubricants such as soap water, liquid paraffin wax, or castor oil can be used as a lubricants for honing the knife. Then, coming to the technique of honing, so there is a you need to hold the knife very firmly, and we need to keep a grip with your thumb on the honing guide of the knife, and you need to start moving it diagonally from forward to backward while facing the sharp surface away from your face. So like that you need to do. Meanwhile, in between, you need to add a few drops of lubricant to ensure the sharpening of the knife. So this is the technique of honing the knife. Then after sharpening the knife, still there might be some rough surface on the surface of the knife, and that roughness surface can be polished by using stropping. So stropping is a technique where we will polish the already sharpened knife. So already sharpened knife will be polished by stropping. So this stropping can be done on a horseshoe leather. So on horse strop, we can able to smooth polish the knife. So this is all about stropping. Then we have section cutting procedure. So the section cutting process is very straightforward. First, you need to fix the block to the uh, block holder of the microtome. Then you need to adjust to the you need to insert the appropriate microtome knife. Then you need to trim out the excess wax from the tissue. Then you need to adjust the tissue microns back to 4 to 6 microns. Then you need to apply a slight ice on the surface of the block, so the block will become hard, so that we can get thin sections of tissue sections we can obtain. Then we need to start moving the microtome in a rhythmic way, where we will get this different types of sections from the microtome machine. So after obtaining the sections, you need to place these sections in a water bath. Then we need to pick up these sections with the help of a glass slide. So before picking up with the glass slide, uh, we need to add a layer of albumin on the surface of the glass slide. Then we need to start picking the slides on the glass slide, and we need to keep this glass slide on a microwave heater or a hot plate, so that the sections will adhere to the slide. Then there are a few errors that we encounter during section cutting. Those errors are include alternative sections, thin and thick and thin zones of the sections, splitting of sections, or sometimes ribbons won't form during section cutting. Sometimes the sections will adhere back to the block when we are doing the section cutting. Even the wax may crystallize, or there are a few errors that we will encounter during section cutting, and we know the reason, and we can able to rectify the error by using remedies such as if you are getting splitting of the sections, means that is due to the fault might be due to blunted knife. So knife need to be sharpened. So accordingly, we need to identify the error, and we need to rectify the error. So this is faults and remedial suggestions for obtaining a proper section cutting out of the tissue. So yeah, so this is all about errors in section cutting. Next is decalcification. So it is a short topic where it is a procedure where we will remove the calcium tumors from the tissue, because we cannot cut bones directly with the microtome machine. So decalcification is the process of removing of calcium minerals from the tissue is called as decalcification. So this decalcification can be done by using different types of decalcifying agents. So let me show you a few decalcifying methods, such as we can use acids, chelating agents, surface decalcification, electrophoresis, or even ion exchange resins can be used as a decalcifying agents. So here we need to ensure that what is the criteria for a good decalcifying agent. So a good decalcifying agent need to completely remove the calcium from the bone. It should cause a minimal damage to the tissue cells. It should not interfere with the subsequent staining of the bone, and it should be reasonably speed at decalcifying. So this is the criteria, and the criteria of deciding what method we need to incorporate for decalcification depends upon the urgency of reporting, degree of mineralization, scope of investigation, and subsequent staining technique. Depending upon this, we may choose one of these decalcifying methods. So here we have then we have certain factors that will influence the decalcification. So the factors include concentration, temperature, agitation, suspension, and volume. Tissue to decalcifying volume need to be adjusted uh, a for a for an efficient decalcifying process, right? So we have different types of decalcifying agents such as acids, chelating agents, surface decalcifying agents, electrophoresis, and ionization resins can be used as a decalcifying agents. So yeah, so coming to the acids, so these acids are further divided into weak acids and strong acids. So strong acids such as a nitric acid or hydrochloric acid can be used, and weak acids such as formic acid or acetic acid or even picric acid can be used as a weak acids for decalcifying the tissue. So usually in the lab we will use weak acids. So weak acids are very friendly or the best acids to be used for decalcifying, and it will take around 1 to 10 days to decalcify the tissue. Then we have a post-decalcification procedure. Since we decalcify the tissue in acids, the overall pH of the tissue will become acidic, and this acidic need to be neutralized by placing the bone under running tap water for at least 12 to 18 hours. By suspending the bone in a running tap water for 12 to 8 hours, we can able to neutralize the tissue's pH. So that is called post-decalcifying procedure. Then we have other techniques like chelating agents. So chelating agents such as EDTA can be used for removing calcium from the tissue. They can use surface decalcification. So this is a suddenly when we are cutting the section, we will encounter some bony tumor, and at that time we cannot deparaffinize. We cannot go for reverse steps of tissue processing. Rather than we can simply expose the surface of the bony layer on the decalcifying agent, and we can able to do the surface decalcification. So this particular mechanism procedure is called as a surface decalcification. Next we have electrophoresis. So electrophoresis is a method of removing calcium ions with their charge by applying electricity to the solution. So we know that the calcium has a positive charge and they will migrate towards the negative charge upon electrophoresis. By this way, we can able to remove the calcium ions from the bone, but it doesn't have much benefits, and we are not using this technique regularly in the labs. And next thing that we can use for decalcifying are by using ion exchange resins. So resins are the charged solutions that can be used to remove the desired charged molecule. In case here, we will remove the calcium by using negative charged chloride ions, chloride ion resin. So this is called ion exchange resins, and they will have very good rate and faster. They have very good fast rate at removing the calcium from the tissue. So this is all about decalcifying. Then we have end point of decalcification. How can we detect whether the tissue was completely decalcified or not? So to detect whether the tissue completely decalcified or not, we can go for doing some tests to assess whether the tissue was completely decalcified or not. So those methods include, we have three methods: radiological method, physical method, and chemical method. Radiological methods include just simply we need to subject the section to the X-rays. So in the X-rays we can see if there is any bone, means we can find the bone. And physical methods include just take a needle and prick the bone. If it becomes soft, means it indicates decalcified. If it is still hard, means it is not a decalcified. And chemical method is, in the chemical method we can use sodium hydroxide. So we need to add a drop of sodium hydroxide and in ammonium oxalate. Sodium hydroxide and ammonium oxalate need to be added to the solution. If we see any white precipitate, means that indicates presence of calcium within the solution. That means that indicates the calcium was removed from the tissue. So precipitate indicates complete decalcification of the tissue. So that in that way we can able to understand whether the decalcifying occurred or not. Yes. So then after decalcification we have staining. So the staining can be done by using a different types of stains such as hematoxylin and eosin can be used for staining the tissues. So if you see the principle of HMD staining, we know the pH, we know the pH of the cell. So the nucleus has acidic pH and the cytoplasm has basic pH. And this acidic nucleus will show affinity towards the basic dye. In case in the hematoxylin is a basic dye. So this basic dye will migrate towards the nucleus of the cell, whereas the basic cytoplasm will show affinity towards the acidic dye, which is eosin. So by this we can able to stain the cells. So the principle of H&D staining is the acidic component of the cell has the affinity towards the basic dye, and the basic component of the cell has the affinity towards the acidic dye. In hematoxylin and eosin stain, hematoxylin stains the acidic part of the cell, which is the nucleus. So the hematoxylin is also called as nuclear stain. while eosin acts as a acidic stain and bind with the basic part of the cell, which is the cytoplasm of the cell, staining in pink color. So eosin is also called as cytoplasmic stain. So this is the basic principle of HND staining. Then we will go for the procedure of HND staining. So as we know that when we obtained the sections after section cutting, the sections are already impregnated within the paraffin wax. So paraffin wax cannot stain it. We cannot directly use, we cannot stain if the tissue has a layer of paraffin wax, because paraffin wax is a hydrophobic. Now we need to remove this paraffin wax. So the first and foremost step in tissue section cutting is deparaffinization. So we need to deparaffinize the section by subjecting the section in xylene solution for 5 minutes. So the same step need to be repeated twice. So we need to deparaffinize the sections by suspending it in a xylene solution for 5 minutes, 2 times. Then we will incorporate water into the section. We know that we removed water from the section during section cutting, right? Now we need to rehydrate the section. So this rehydration happens in descending order now. So first we will suspend the tissue in 100% alcohol, then 95, 80, 70, 60, 50, 30, 20. So slowly we will incorporate water into the section. So this is a descending graded alcohols. So by subjecting the tissue into descending graded alcoholic solutions, we can able to reincorporate water into the tissue. So same, if we directly keep in the water, it may damage the cellular architecture. So that is why we will slowly incorporate water back into the tissue by subjecting the tissue into descending graded alcoholic solutions. After this particular step in HND staining is called as hydration. After hydration, we will go for staining with primary stain, which is the hematoxylin. So we need to add 3 to 4 drops of hematoxylin on the section, and we need to wait for 3 to 5 minutes. After that, we need to wash in the water. Then we will differentiate with 1% acid alcohol. Now the hematoxylin may stay in the cytoplasm also. That cytoplasm hematoxylin need to be removed. That removal can be done by dipping the slide in a 1% acid alcohol solution. So by dipping in 1% acid alcohol solution, the hematoxylin that is present in the cytoplasm will be removed, but still the hematoxylin that is present in the nucleus will remain intact. Now we will wash in the water. Now there is a problem. Since we dipped the section in a 1% acid alcohol, the overall pH of the cell will become acidic. That means even the cytoplasm will become acidic because we dipped in a acid alcohol. If this happened, the hematoxylin that is present in the nucleus of the cell will start migrating towards the cytoplasm, because the cytoplasm also become acidic. That is why the overall cell become blue. So we need to regain the original pH of the cytoplasm, right? So that is done by suspending this particular slide in a alkaline solution. So alkaline solution is saturated lithium carbonate solution. So that is why we will suspend this section in a lithium carbonate solution. So this step is done to regain the original pH of the cytoplasm of the cell. And this particular step is called as bluing. So bluing can be done by using saturated solution of lithium carbonate for 2 to 3 minutes. By this, we can regain the original pH of the cytoplasm of the cell. Meanwhile, the nucleus will stay acidic, and it will have the hematoxylin dye to it. Okay. Then we will rinse in the water. Then we will go for a counter stain with eosin for 1 minute. Then we will wash under tap water. Then once again we will remove water from the section, clear with the xylene. Clearing means we will remove alcohol from the section, and we will go for mounting with DPX. So permanent preservation of the slide, and we can able to observe the slide under the microscope. So this is all about the HND staining. So the interpretation will be nucleus will be in blue color, whereas the cytoplasm will be in pink color. So we have different types of reagents, such as Harris hematoxylin can be used, and different types of hematoxylins can be used, right? Then I have given a short notes regarding preparation of acid alcohol, preparation of HND staining, preparation of eosin I have given here. Then points to be remembered: this hematoxylin is we obtained this hematoxylin from a tree, and this is the original powder of the hematoxylin does not have any staining properties. So we need to ripen the stain, that I will discuss later. So meanwhile, let us discuss about differentiation. So differentiation means it is a procedure of differentiating any two stains or any two regions of the cell is called differentiation. This differentiation can be done by dipping the slide in a 1% acid alcohol solution. So the stain that is present in the cytoplasm will be removed. Meanwhile, the stain that is present within the nucleus will stay clear. It won't remove. So that is called differentiation. Then bluing, as I said, we need to regain the original pH of the cytoplasm of the cell. That can be done by suspending the tissue in a lithium saturated lithium carbonate solution. So by suspending in the saturated lithium carbonate solution, which has alkaline pH, they can able to regain the alkaline pH of the cytoplasm back to the cell. So this is called bluing. Then we have mordant. Mordants are the substances that will bind the dye to the tissue. So any agent that will enhance to bind the dye to the tissue are called as mordants. So mordants are the intermediate substances which will bind the tissue and the dye. So the dye and mordant should be simultaneously applied. Salts of ammonium, iron, molybdenum, or tungsten can be used as a mordant. So mordants are the substances that will bind the dye to the tissue. They are called mordants. So in case of HND staining, we will use aluminum potassium sulfate or aluminum ammonium sulfate can be used as a commonly used mordants in the HND staining. Then ripening, as I stated, now we need to convert the hematoxylin dye into a stain. I need to incorporate charge to the stain. Only after converting dye to stain, we can able to stain to a living cell or any human tissues. So that is why conversion of hematoxylin to stain is called as ripening. So this ripening can be achieved by two methods: natural method and synthetic method. Natural method is you need to take this hematoxylin solution and you need to expose this stain to the hematoxylin powder solution to the sunlight for 3 to 4 months. So after 3 to 4 months, the hematoxylin will get activated and it will ripen. It will become a stain. So this is called natural method. Whereas chemical method also we have. So this chemical method is simply we will add oxidizing agents to the hematoxylin solution. So by adding this oxidizing agents, the hematoxylin will immediately ripen. So within 1 to 2 days, the hematoxylin will get ripened upon addition of oxidizing agents. So oxidizing ripening is very faster method to convert a dye to stain, a hematoxylin dye to the hematoxylin stain. So usually we will use this chemical oxidation methods for ripening the hematoxylin. And this particular concept is called as ripening. Okay, ripening means making dye to stain is called ripening. Yeah. So this is all about tissue processing and section cutting, then staining. Then after staining, the last and final topic that was left is mounting. So by this we can say goodbye to the histopathology actually. So what is mounting we can see. So in today's lecture we are going to discuss about mounting in detail. So pay utmost attention from now onwards. So from now onwards we are going to study about mounting. So what is this mounting? So mounting means after staining with hematoxylin iosin, now the section is on the slide. Now I need to preserve this slide. So how can I preserve this slide? I will add a drop of mounting agent such as Fevicol. You can feel like a transparent Fevicol. Then I will add a cover slip. So this Fevicol will firmly attaches to the slide and it will preserve the section. So this is called mounting. So mounting means in histological sections which need to be examined for any length of time or to be stored must be mounted under a cover slip. There are two types of mounting media. We have aqueous media and resinous media. I will discuss later. So the main aim of the mounting is to put the final sample in a medium where it is protected and can also be observed under the microscope. The sample is dehydrated again and a drop of mounting agent with a similar refractive index to that of glass is placed on the glass slide and covered with a cover slip is added. So usually used mounting agent is DPX. Dextrine polystyrene xylene will be used as a regular mounting medium. Other than DPX, we can also use Canada balsam or diluted xylol can also be used as a mounting agents. So let me show you the mounting agent. So this is a drop of mounting agent added on a stained section and I added a cover slip and I mounted the section. So mounting media are therapy fluids that are used between the section and the cover slip. We should ensure that they refract. Yes, the refractive index of this particular mounting agent should be 1.51 and two main types of mounting media are used regularly. One is resinous media and the other one is aqueous media. Resinous media is used for dehydrated and cleared xylene tissues, whereas aqueous media is used for sections directly from water. So usually aqueous media is used for histochemical sections, whereas our regular histopathology sections will be subjected to resinous media only. So the example for resinous media is xylene balsam, or we can also use DPX, dextrine phthalate xylene can also be used. So let us see the DPX. So DPX was introduced in 1936. So earlier tricrystal phosphate is used as a plasticizer. So the refractive index of DPX is 1.52 and the composition of DPX is distrin 10 grams, dibutyl phthalate 5 ml and xylene is 30 ml, 35 ml. So this is the composition of DPX. So D dextrin, P phthalate, X xylene. So distrin phthalate xylene is the complete name of this particular DPX. So we will take the section and we will add a DPX solution and we will cover with a cover slip. That's it. So by this we can able to preserve the sections for a long time. So DPX stands for distrin dibutyl phthalate xylene is the complete full form of the DPX. So a quick introduction about mounting agent. So mounting medium is the solution in which the specimen is embedded, generally covered under a cover slip under the glass. So it may be liquid, gum or resinous, soluble in water, alcohol, other solvents can be used to seal from the external environment by non-soluble ringing media, right? So the main purpose of mounting media is to physically protect the specimen, and the mounting media bonds the specimen slide and cover slip together with a clear durable film. The medium is important for the image formation as it affects the specimen retention. So mounting a tissue specimen is essential for preserving the specimen during storage as well as for enhancing image quality during microscopic examination. In order to provide the maximum degree of transparency to stained tissue sections, the refractive index of the mounting media must be approximate to that of dried protein, which is around 1.53 to 1.54. So there are two categories of mounting media, which is aqueous mounting media and resinous mounting media. Usually we will use this resinous mounting media, and the refractive index of the resinous mounting media should be around 1.51. So that is an ideal mounting media refractive index. And there are few properties that we need to ensure when we are selecting a mounting media. So the properties include refractive index must be 1.51. It should be colorless and transparent. It should not cause stain to diffuse or fade away. It should be dry to a non-sticky. It should be dry to a non-stick consistency and harden relatively quickly. It should not shrink back from the edge of the cover slip. It should be able to completely permeate and fill tissue interstices. It should have no adverse effects on tissue components. It should be resistant to contamination, particularly from microbial growth, and it should protect the section from physical damage and chemical activity during regular laboratory handling of the section. And also it should be completely miscible with the hydration and clearing agents. It should not it should set within crystallization without cracking or shrinking. Okay, so this is the few properties that the mounting media need to be there. So that's it. So this is all about the mounting. If you want, I will show you a video of the procedure of mounting here. So now I will show you the procedure of mounting. Kindly watch the video, students. So simply you can imagine yourself like placing a drop of very clear how can I say a clear simply like a Feviquick. You are adding a Feviquick and you are keeping a cover slip on the slide. So the slide will completely stick to the slide and it will preserve the section. So now I will show you the mounting of section here. So kindly watch this video. So watch this video, students.
Hi, I'm Dr. Terry Bruce. I'm the manager of the Jordan Hall Imaging Facility in the Biological Sciences Department at Clemson University. And right now we're going to be looking at how to mount a cover slip onto a glass slide. And it's not as easy as it seems. And here's why. First of all, you need to make sure that you have the right materials ready to go before you start to mount your cover slip. You don't want to get things in your hands and then not be able to grab what you need. So first you need to decide how you're going to mount your cover slip, what kind of mounting media you're going to use. You're going to need some kind of media between your cover glass and the glass of the slide, otherwise your cells will dry out. So options for this include glycerin or PBS glycerol, a 50-50 mix. There are also several different commercial mounting medias available on the market, including those that have DAPI in them, so they have stains in them. I want to take.
So she's using other than DPX. Let me keep DPX mounting to you. Yeah, here I think he's using DPX here. Let us see.
Hi, have you always wanted to learn to code but don't know where to start? Would you like to make
Okay, let us watch this.
हाय, माय नेम इज़ दिनेश कुमार ध्रुवे। एक बार फिर आपका मेरे यूट्यूब चैनल में स्वागत है। आज जो मैं आपको बताने जा रहा हूँ तो ये जो है माउंटिंग के बारे में बताने जा रहा हूँ। तो माउंटिंग एक्चुअली होता क्या है, हम लोग जो है स्लाइड जब बन जाता है उसके बाद जो है H&E स्टेन करते हैं, इसको मेटॉक्सिलेन और स्टेन करते हैं। उसमें क्या होता है, स्टेन होने के बाद जो है स्लाइड को जब हम जाइलिन से निकालते हैं तो उसके बाद जो है इसको हम माउंट करते हैं। माउंट क्यों करते हैं, माउंट करने के पीछे जो ये कलर हुआ है या डाई हुआ है ना, तो ये जो कलर हुआ है H&E हेमेटॉक्सिलिन और ईओसिन स्टेन हुआ है, इसमें स्टेनिंग के बारे में बाद में बताया जाएगा आपको। तो इसका जो है स्टेनिंग कलर ना उड़े, है ना, तो उसके लिए जो है अपन इसको माउंट करते हैं। तो माउंट करने के लिए अपने क्या क्या चीज़ चाहिए, ये कवर स्लिप चाहिए रहता है ना। कवर स्लिप भी अलग अलग शेप के आते हैं, है ना। ये छोटा वाला है, फिर ये बड़ा कवर स्लिप है। जैसा हमें चाहिए उस हिसाब से अपन कवर स्लिप जो है यूज करते हैं, है ना। उससे भी एक छोटा कवर स्लिप आता है, वो हमारे पास रखा हुआ है, ये है ना। इसका साइज़ वगैरह सब इसमें दिया हुआ है ना। 18 mm का है, 10 ग्राम्स का है इसमें। 22 हम ये माउंट करते हैं। तो हमारे यहाँ जो माउंट होता है वो ड्राई माउंट होता है। ड्राई माउंट का मतलब ये पूरा स्लाइड जो है सूखा रहना चाहिए, है ना। तो ड्राई माउंट हम इस तरीके से करते हैं। ये टिश्यू है जो हमने कटिंग किया है ना। तो उसके हिसाब से इसमें 2 टिश्यू हैं, इसमें 3 टिश्यू हैं, तो इसमें बड़ा कवर स्लिप लगेगा, इसमें छोटा कवर स्लिप। तो ये हो गया अपना। उसके बाद जो है हम माउंट अब करते कैसे हैं, तो ये DPX है। DPX का फुल फॉर्म जो होता है ना, डेक्सटिन पॉलिस्टीन जाइलिन, इसमें रखा हुआ है। तो इसके थ्रू जो है अपन माउंट करते हैं। तो माउंट कैसे करते हैं वो आप देख लीजिए, है ना। सबसे पहले ये स्लाइड में माउंट करके बता रहा हूँ। टिश्यू देखना है कौन सी तरफ। यहाँ जो HP नंबर लिखा हुआ है वो हमने लिख कर रखा है ना। ये जो है डायमंड पेंसिल से लिख करके रखा है HP नंबर जो हमने दिया था वो पेशेंट का, अभी तक यहाँ तक है वो HP नंबर, वही HP नंबर इस स्लाइड में, है ना। तो अपन 2 तरीके से इसमें माउंट करना बता रहा हूँ। सबसे पहले कवर स्लिप आप नीचे रखिए, ये कवर स्लिप है आपका, है ना। इसमें जो है आराम से 2 ड्रॉप या 3 ड्रॉप जो है हमने DPX डाला। उसके बाद इस तरीके से इसको पकड़ा हमने ये करके, और इसमें जो है ध्यान रखना है कि पूरा बबल्स नहीं आना है। इस तरीके से आराम से, और इसको इस तरीके से उठा देना है ना। ये हमारा नंबर है, नंबर को इससे नहीं ढकना है ताकि ये नंबर जो है हमारा बराबर दिख जाए। तो ये अपने आप जो है फैल जाता है पूरा DPX कवर स्लिप में, और ये कवर हो जाता है पूरा, है ना। तो इस तरीके से ये पूरा जो है क्या हो गया, माउंट हो गया है ना। इसको अपन जो है लाइट से ऐसे करके देख लेंगे कि इसमें बबल्स वगैरह तो नहीं है। अगर बबल्स वगैरह है तो इसको जो है अपन प्रेस करके हटा लेते हैं फोर्सेप से, है ना। इस तरीका हो गया, है ना। उसको फिर अभी अपन इसी तरीके से रखेंगे। फिर दूसरा तरीका जो है अपन के इस तरीके से इसमें फिर आप स्लिप को जो है DPX डालिए, और कवर स्लिप को जो है ऊपर से आप इस तरीके से इधर रखना है एक साइड। उसके बाद धीरे से जो है ऐसे करके इसको कवर स्लिप को छोड़ देना है ना। अपने आप ये फैल जाएगा। अगर बबल्स आते हैं तो उसी तरीके से हटा देना, देखना है बबल्स है या नहीं है। थोड़ी देर आप इसको इस तरीके से रख दीजिए, और जो HP नंबर यहाँ पर लिखा हुआ है ना, वो HP नंबर अपन इसमें डाल देते हैं। रिज्यूम कर लाइट में 3991 का 2017 जो ईयर चल, ये तैयार हो गया, और इस स्लाइड को आप जो कलर है वैसे ही का वैसे रहेगा, है ना। तो इसमें कोई दिक्कत।
So this is all about your section cutting and tissue processing, students. So if you have any issues, if you have any clarifications, you can ask me. If not, I will end this session. So if you have any questions, you can ask me, students. Hope nothing. So thank you very much. So thank you very much.